Well, I'm a skin cancer survivor. Luckily, wound up with Dr. Sutton here at UNMC. Incredible level of care, incredible staff.
When I met Doug, I could sense he had had some challenges to date. He had had a surgery already. The cancer wasn't completely clear. He was, scared about the next steps. But what I felt really reassured by is I knew Doug was in the right place because we had the tools to take the very best care of him. And so when we think about, Mohs for melanoma and being able to exhaustively look at all of the edges, Doug is the perfect candidate for this type of surgery to be able to optimize our outcomes and optimize our cure rates for our patients. Because ultimately, all goal is cancer cure so that our patients can go back to doing all the things that they want to do. So, being able to see Doug back at our last visit, once the cancer had been completely removed, he had continued his regular skin checks with his board certified dermatologist. He was healed. I really see that as a success, and that's one of the things that makes me extremely happy as a physician to be able to see my patients from the first step to when they're diagnosed with skin cancer to that day when we can say, yes, you are cancer free, you are completely healed, you continue with your regular skin surveillance, and we're here to help you in any way that we can.
Just everything is very upbeat here, and everybody's on time, and he makes you feel really good about the whole process. And from the first appointment to the last, it was really terrific.
Melanoma is a cancer, the color producing cells of our skin. And when we think about melanoma, the most important thing is the depth of that melanoma, and that's measured underneath the microscope. And so, based on the depth of melanoma, we know how much surrounding tissue we have to take around where we definitively see that melanoma. So, when you have a biopsy proven melanoma, and that biopsy is most often taken by a board certified dermatologist, those patients are referred to us for surgical management of their melanoma. All of our surgeries are done in our clinic. They're done under local anesthesia. We've got lots of tools to make our patients nice and comfortable on the day of surgery. Our patients are listening to music of their choice. We're talking them through each step of the way. So they're really the way that we approach care for our patients is we don't want our patients to ever feel surprised in the way that they're being taken care of.
You need to deal with this, especially at my age. I'm 78, and cancerous melanoma is obviously a potentially fatal malady. And if you're not seeing your dermatologist regularly, you're taking a big risk. It could be the end for you.